People will say that women attempt suicide more as a counter. I say that is because women often attempt suicide as a call for help, whereas men don't call out for help often because they don't believe they'll get it, so they just go right for the hard suicide attempt.
There's some evidence to support your perspective. Research has shown that men are less likely to seek help for mental health issues, and this could contribute to the higher rate of completed suicides among men. Women, on the other hand, may be more likely to seek help and support for their mental health struggles, which could lead to more reported suicide attempts. Additionally, men may choose more lethal means of suicide, such as firearms, which could account for the higher rate of completed suicides among men.
What's interesting is even in men and women that aren't suicidal or even depressed, when they are asked how they would commit suicide, if they were do so, men tend to choose methods that more assure death.
Yes, research has shown that men tend to choose more lethal and violent methods of suicide, such as firearms or hanging, while women tend to choose less lethal methods, such as drug overdose or self-poisoning. This could be due to a combination of biological and cultural factors, as well as differences in coping mechanisms and attitudes towards seeking help.
People always talk about men being macho, and that's why they do it, but people never really seem to consider the possibility that maybe men do try, but society doesn't care to help them.
That is a valid point. The pressure on men to appear strong and not show vulnerability can make it difficult for them to seek help and support when they need it. Additionally, there may be societal and cultural norms that reinforce the idea that men should be self-reliant and not seek help from others, particularly mental health professionals. This can lead to men feeling isolated and unsupported, which can exacerbate mental health issues and increase the risk of suicide. It is important for society to address these cultural and societal pressures and create an environment where men feel comfortable seeking help and support when needed.
Well, it is more like people are less willing to help men and just tell them to deal with it.
There could be different reasons why people may be less willing to help men when it comes to mental health issues. One reason could be societal expectations and stereotypes that portray men as strong, emotionless, and self-sufficient. This can create a barrier for men to seek help because they may feel ashamed or weak for admitting they have a problem. Another reason could be the lack of resources and support available specifically for men's mental health, as mental health services and programs are often geared towards women. Additionally, there could be a lack of awareness and education about men's mental health issues, which can contribute to the stigma and misunderstanding surrounding these issues.